Hi, everyone. This is Sean with the Western Mass team of the MassSupport Network, here with the Massachusetts Weekly Public Health Report for Friday, October 23rd, 2020. So we're going to start by looking at cases under quarantine. These are suspected cases, people who've been exposed to COVID-19 but have not had that confirmed by a test. Here's where things stood last week. And here's where they are this week. Increase of about 600, exactly 600 people under quarantine at the moment. The data is all from Wednesday, which is when the public health report comes out, with a few updates from the latest dashboard from yesterday night. So this is the confirmed cases, people who are currently under isolation. As of last week, it was 9,762 people were under isolation. This week, it is 10,526. So a increase of about 800 more people in isolation, more confirmed cases. Of course, remember with these, people are always coming into an and out of isolation when their term ends, because everyone's in there for a 10-day period. So this means that there's just more people coming into it than are going out of it these days. Okay, so let's look at how our hospitals are doing. So as you can see here with last week's data along the bottom and this week's on the top, there's been steady increases in all the metrics here. Hospitalizations, ICUs, and intubations are all increasing. So they're not skyrocketing, but we should expect to see more of these in the coming weeks. As cases trend up, we should also expect to see that as So here is who's being infected currently. The average age has stayed the same. People on average are 38 is the average age for being infected, whereas 66 is the average age for hospitalization, and 81 is the average age for deaths. So looking at how our contact tracers are doing. They are steadily turning out the work there with reaching a higher percentage of people, even though the case counts are rising. So good work there, guys. Both the percentage of cases reached and the percentage of contacts reached increased this week, as did the percent reached within 1 day. So that's encouraging there, just that people are able to get their contacts traced quickly, which is very important for preventing widespread transmission. Speaking of which, let's look at the maps. So here is the daily incidence rate of the state as per the previous week's data. So as always, this chart shows the average daily number of new cases per 100,000 people over the last 2 weeks. And I always have to spell it out like that because it's kind of a mouthful to get your head around to make sure you look at that. Now, green have fewer than 4 cases per 100,000 people, but towns will show up gray if they had fewer than 5 total cases, regardless of what that is per population. So there are probably some very small towns here which only have 2 or 3 cases, which would have a rate of 20 per 100,000 people because they're so small, but they don't show up here because we don't count anything that has fewer than 5 cases. So this is where things stood last week. And here is where they are this week. So as you can see, there's been a lot of spread across the state. That is both, it's called vertical and horizontal, as I call it. I don't think those are real epidemiology terms, but both additional communities showing up the map and severity increasing. One interesting new feature that they've added to the map is showing, putting an asterisk on communities that have a long-term care facility, a college, or a correctional facility that has more than 10 confirmed cases in the last 2 weeks, and those cases make up 30% or more of the total cases for that town in the last 14 days. So that's just an interesting way to look at the spread to see, for example, I always will pick on Western Mass here, but there is, that's going to be UMass Amherst right there, which is going to be most of the spread in its community. But so that's important to know, because those are one, centers for outbreaks, but two, it can show that an outbreak is contained to a sub-community rather than the community at large. But we also see several of these out in Eastern Mass here. All right, another thing to note here is that last week, the state daily rate was 8.7 new cases per 100,000 people over the last 2 weeks. And now it's 9.2. So again, another jump of about half a case per day per 100,000 people. We've continued to trend upward. So this is the percent positivity map. This shows what percentage of COVID tests are coming back positive in any given region. This is worth looking at for a number of reasons over the last one, in addition to the last one, because it can show us where we're doing enough testing, or also where the size of a community may be throwing off the numbers. You'll note, for example, most of Western Mass was gray on the last two maps, but we do see that there are some cases there. It's just that there's so few. So this is where we stood last week, and here's where we are this week. So the state rate has jumped the highest it's ever jumped, basically doubling in the last week, which is not good at all. You can see that basically any community in that darkest color of blue is going to be above the state rate. And there's a lot of places like that in Eastern Mass and a couple in Western as well. These are important to look at because there are, because these can mean two things. Either there's a significant outbreak there, or there's just very little testing being done in that community. And both are things important to know about. We talked briefly a moment ago about how some places where they added the asterisks to the map, there are colleges as one possible source of spread. So this is the information from higher education testing. So last week we saw 119 new cases from institutions of higher learning. I'm sure there's some official reason why you don't say colleges or universities, but on that. So I was kind of hopeful that 119 cases meant that it was trending down in colleges. Unfortunately, we've bounced back up to 231. And that is with some more testing than last week. It was 188,000 cases last week, and this week it was 232,000 tests, excuse me. So more testing is good, and it's possible that some of those cases came as a result of additional testing as we do more screening testing, or perhaps some colleges are doing more targeting testing, following up on potential outbreaks, doing contact tracing, but I'm not gonna pin my hopes onto that. So in general, things have been trending up here. As I said earlier, yesterday was our highest day since the downswing from our initial surge. So one way I want to look at this graph, I normally show the different way counties are, but that's an old slide I left in there. This graph shows each county as a percentage of the whole over time since late August. And just to show you how the different county spread has changed over time. So I tried to go with the colors that were the easiest to tell apart here, but I understand if this kind of turns into a little bit of magic eye painting for you here. But the counties go alphabetically from the bottom to the top. So that's Barnstable is the barely visible green along the bottom, and Worcester is the blue at the top. So you can see at some points where there have been changes. For example, Suffolk County, which is this green area up here, which I was reaching up with my finger to point out to you somehow, was back in August the largest easily area of here of the state, and has actually trimmed things down a bit over time. So it's making, now, of course, one thing to be aware of with a chart like this is this just shows the percentage of the state as a whole. So an area that is getting smaller could be because the county itself is having fewer cases, or it could be because the rest of the state is having more. So that's just worth knowing there. But you can see, for example, how Suffolk had a larger area here, and then tightened up a little bit, expanded again here, and is generally smaller than it was. Worcester has more or less stayed even, for example, than over the course, meaning that it is kind of matching the general state spread. You can also see how closer to the bottom, Essex County has ballooned outward in a couple of places, and Middlesex has usually taken up a significant portion as well there. So that's just something interesting. I found interesting to see. So I'm not doing every week with just another, this is a trend line by the county. All right, so one last thought before we go into the weekend here. So we heard earlier in the week that a participant in the AstraZeneca Oxford University vaccine trial had died from COVID-19. So it is reported that this person was in the placebo group, meaning that they were one of the half the people in that trial that received a non-active injection instead of the trial vaccine. And they contracted COVID and passed away. We don't know this person's name or have a picture of him. All we know is that he is a 28-year-old man from Brazil, reportedly who was actually a physician working with COVID patients. But I just want to put this up to kind of remember there are many people out there who are literally putting their lives in the line to test out these vaccines for the rest of us. And I just thought it was important to remember people who gambled their lives to help this move forward to the idea that the rest of us might have a vaccine sometime next year, and some people are paying the ultimate price for their bravery. So I just thought that was something important to recognize, even though I know it's kind of a downer to end the week on. But for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.